I'm the owner and senior midwife here at Embrace Midwifery Care and Birth Center in Richmond, Virginia. Wow, life is changing minute by minute, it feels like, concerning the COVID-19 virus. And we're changing with it, and that can be frustrating for everybody. But as we know better, we're trying to do better, and sometimes that means that means we make a different decision within minutes of making the first one. It really has been about 5 days now of really trying to stay current and stay updated on what's the best course of action for our clients, for our midwives, and for our community. I think the concern with this virus more than anything is the fact that it's very contagious, and it can be transmitted for days to weeks before symptoms actually present themselves. So the concern as a business owner is that you can walk in the door feeling fine, and you can share it with all of us or with other people in the waiting room with no consciousness around that. And that's where I think that we're really seeing the concern. That's why we're seeing businesses close. That's why we're seeing people make different decisions. It's not that I have the sniffles and I shouldn't be around you. It's that I can feel fine and exponentially spread this virus in our community. And the thing is that we talk a lot about how I'm healthy and I'm young. Okay, maybe I'm not young, but you know, most of my clients are, and that they have good immune systems and they're well nourished, so they're safe, and that may be true. Although we don't have the jury's still out on how this might affect pregnancy and newborns, what their risk factors are. But the thing is that we all have people in our lives that are vulnerable. People with chemo, with cancer, with asthma, with bronchitis issues, elderly people. And the thing is that again, it's not just that we're concerned about ourselves, our clients, but we're concerned about what's going on in our community as people come in and out of our birth center. So we're trying to make the most responsible decisions while still providing excellent care, and that's a challenge. That's a challenge to make sure that our patients and our clients feel that their needs are being met while we're still making these hard decisions. Right now, we don't have a great answer on how it's affecting pregnancy. The jury's out. On one hand, they say they seem like there's not a whole lot of transmission between the mother and the baby. However, as I'm sure many of you have heard, they're asking for mothers with active infections to be separated from their newborns for 2 weeks. If they can't be separated, they should pump and they should have the baby's bottle fed. If they choose to breastfeed, there's precautions in place for that too. There's hospitals that are closing down visiting programs completely, one partner only in the labor rooms. One hospital called for nobody in the labor room with women. The doulas are fighting, rightfully so, to be able to go in and support their clients. It's affecting all of us, and we're trying to do our very best. If you have questions during this time, please feel free to type them in, and Dallas will go ahead and so the good news is Embrace is close to emergency services. The bad news is sometimes emergency services, break into my lives. Sorry about that. Dallas will read any questions that come through off, and I'll be happy to do the best I can to answer them, keeping in mind I'm a low-risk community midwife, not an immunologist, so we're going to keep looking to the experts for answers. I also ask for our clients to be patient with our continual changes. As we go through this, we are trying to stay current, and like I said, that can be really frustrating, but we're only doing what we think is best as we get more information. So I'm going to answer a few questions. Here at Embrace, we're making some big changes to keep you safe. One of them is canceling all non-essential appointments, and that feels really rough to me. We are currently setting up video conferencing that is HIPAA compliant so that we can continue to see our clients for their appointments, even if we can't have them in the space at Embrace. This means that although we're still doing initial visits so that you can establish care with us and you can have a provider that you can call and resource information from, we are not doing any other visit until 28 weeks when we want to see you again. That way we can do your glucose testing, we can check for anemia, screen for any other lab issues, give you RhoGAM if that's appropriate to you, or check for your antibody screen. And then we're wanting to go back to teleconferencing or televideo chats until we get to about 36 weeks. And then in your last kind of due month, we want to see you more often so that we can prepare for birth together. I know that is not ideal. Midwifery is built on love and connection and community. I'm going to miss you all in and out of the space, the laughs that we have shared and the times that we get to hang out together. But this is just more important than that. This is important that we protect everyone at this point. We're also going to ask you to not come to Embrace if you have any symptoms or anybody in your family has symptoms. Unfortunately, a small dry cough with allergies can look a lot like COVID-19 at this point, and we just don't have much that we can discern. Yes, we can feel okay. Yes, we can have, if you look at the symptoms, there's a broad spread of them, including things like diarrhea. 15% of people are experiencing that. So we don't know what those symptoms mean, and we don't have enough tests to be able to make sure that everybody is protected or diagnosed. We don't have enough tests, right? So we want to make sure that while we're in this kind of gray area that we're being proactive. When you come for your appointments, we welcome you and your partner. However, we are going to ask that you not bring your children or any other support people to the birth center. One of the big concerns is Jess and I are the midwives here. This is not a hospital where we have a staff that's endless. And even in the hospital settings right now, the staffing shortages are critical, and we're all hearing about this. They're sending everybody home with symptoms. They don't have the test to be able to check in on that. So Jess and I are doing everything we can to protect ourselves during this time so that we can be there for you, including social distancing, including taking care of our health, spending time in fresh air and sunshine, taking our vitamins, taking probiotics, taking extra vitamin D, taking extra vitamin C. There's some really safe ways we can boost our immune systems, and we're trying to do that as much as possible. Thankfully, as a birth center, we have lots of, I shouldn't say that maybe, like it's worth gold around here these days, but we have lots of sanitizer for hands. So we're washing, and lots of soap. We have lots of soap. So lots and lots of soap. So we're washing. We're disinfecting between each and every client, disinfecting all equipment, but also things like toilet handles, things like light switches, things like the arms of the couches, anything that may have been touched. So that's kind of gone into hyperdrive. We also have birth assistants that come to every birth, and we are also working hard with them to make sure that they're protecting themselves the best way they can, and also letting them know that if anybody is symptomatic, they are absolutely not on duty anymore. So we're screening that religiously. We're not taking any students. We're not doing any classes at this point. We're just not doing any non-essential visits, and we're trying very hard to minimize everybody's exposure. We're working to do HIPAA-compliant visits, HIPAA-compliant classes, converting as much as we can to online so that you still have access without exposure.
Busy day.
Busy day. Late transfers. There's a lot of talk about women who don't want to go to the hospital now that there's so much chaos there. There's also some scary things about doctors saying you should be induced, or even I've heard that one doctor recommended a cesarean so that she could come in, have a baby, and go home. They're trying to control every aspect, including visitors. I'm not going to speak on whether I think that's right, wrong, or indifferent. What I'm going to speak on is here. So we do still have space for late transfers on a case-by-case basis. Certainly, if you're interested in that, we would encourage you to call us or send a message to Dallas so we can help you navigate that. Again, it's a very case-by-case basis. We do have room, but we don't and won't overload ourselves because that just puts us more in a position where we might not be able to serve any woman at all. So we are happy to talk with you about your options, though. What am I missing, Dallas?
Doulas.
We love us some doulas. So doulas are gonna apply the same way everything applies, right? If you have a doula and you want her at your birth, she will be at your birth. My theory on this is you're probably gonna use her at home before you get here. She's probably going to be supporting you some way or another. If she is still willing to come and you are still willing to have her, we want to have that option available for you for sure. I think that doulas are a critical part of the care team during a pregnancy and a birth, and maybe especially right now when women need all the emotional support that they can get.
Home birth and home visits?
Home birth and home visits are such a hard catch. So one school of thought is if I come to your home, I've minimized your risk. However, I've exponentially expanded my own. Here at Embrace, we have medical grade disinfectants, we're minimizing appointments, we have minimal people in and out, so Jessica and I are socially distancing ourselves, we're minimizing our shopping, we're ordering online, we're doing everything we can to protect ourselves. Coming to your house where maybe you've had extended family come visit, I hope not, but maybe, or maybe you have a house full of children, it puts us in a vulnerable spot. So at this time, we are not offering home visits and we're not doing home births.
Is water birth still safe?
It is. It absolutely is. There is nothing and no reason to believe that it would not still be safe. Water birth has nothing to do with, a respiratory issue. If you were carrying COVID-19, having a baby underwater is not going to increase or decrease those risks. Okay. Any other questions or concerns? We are absolutely open. If you are one of our clients, we will still be ordering your labs from here, your ultrasounds from here. Dallas doesn't know this yet, but Dallas is going to be working with all of our moms who are not yet scheduled for their 20-week ultrasound. We'll be scheduling those out so that we can make sure that you get your appointment set up. Your care with us clinically will stay the same. We want to make sure that we're checking in. The benefit of Embrace is access to your midwives. So as you know, or you may know, we have online portal, we have email access, we have a call phone where Jessica and I are on call 24 hours a day to our clients. All of those things still apply. We are still available to you. Unfortunately, we just have to keep some space for a period of time, and we don't know how long this is going to last. But certainly as things change, we'll change with them, and we'll do everything we can to stay current. All right, I think that that's pretty much what I wanted to cover. Let me just take a quick look. I had a few notes here. I want to again kind of remind you that we're primary care providers for your newborn as well. So if you birth with us, one of the things that I would really encourage is that you don't load that child up right away to go out visiting or to have family around. This is true whether I guess you're with us or you're not, but also that Jess and I will be happy to take care of you and that new baby through your 6-week postpartum check, hopefully minimizing exposure for you during that critical time as well. Again, if you have other questions, concerns, you need to talk to the midwives directly, feel free to always reach out to us. Feel free to let us know what's on your heart and what's bothering you. We are open to phone conferences, to telemedicine, to emails, anything we can do to support you. And we'll be checking in with each of you here this week and making sure that you're doing well if you have already started care with us. So thank you so much, and for all of you, just be safe and wash your hands. No, go for a walk in the sunshine. That's the best way to relieve stress and to be healthy and happy. So let's do that instead of focusing on all the fear. But you should still wash your hands. Bye now.